If I had a bunion and I was sitting where you are right now, I know exactly what I would do first. And it would not be what most people do. You have tried the wide shoes, maybe the insoles, and the bunion is still there, still getting worse, and you still do not have a clear answer as to what is actually going on and what to do about it. After 25 years and over 20,000 bunion surgical cases, I have seen every version of this decision play out, and I know which starting moves buy people years, and I know which ones waste time. There is one piece of information almost nobody gets before they start treating a bunion, and without it, every treatment decision you make is a guess. I'm going to walk you through exactly what I would do, in the order I would do it, and why each step sets up the next one. By the end of this, you will have a starting point. Point 1, the move most people make first and why I would skip it. Most people with a bunion do one of two things first right away. They buy wider shoes or they add a gel pad over the bump. This feels like a reasonable response because the bunion hurts when something presses against it, and wider shoes press less. The shoe store even has a section for this. The footwear modification approach has been around for decades. Podiatrists recommend it. It is in every article you will find online, and honestly, it does reduce the friction that makes the bunion hurt on the side. The logic is clean. If the shoe caused the problem, fix the shoe. The problem is that a wider shoe addresses the symptom and completely ignores the deformity underneath. The bunion is a structural change in the bone. The big toe joint is shifting. The process is progressive. A wider shoe doesn't slow this down. It does not protect the joint from continuing to deviate. It just makes today more comfortable while the underlying deformity does whatever it was going to do anyway. 3 years of wide shoes and you could be looking at a surgery that you did not have to have happen. The question worth asking is not how to make the bunion less uncomfortable. The question is what can actually change the trajectory of the deformity. And the answer to that starts with something almost nobody does in the first appointment. You are not doing something wrong to go with the wide shoes, but the first right move is about understanding what the foot actually needs versus what makes the foot feel okay for the afternoon. Here is the other most common mistake people make early on with their bunions. Mistake number 2. The other thing that people do early on is go straight to an orthotic or an insole insert. Sometimes a podiatrist recommends a certain custom orthotic specifically. This is a step up from the wider shoes because at least someone is looking at the foot and it feels like it's the real treatment. It's more specific than shoe shopping. An orthotic can help manage the load on the foot and provide some structural support. But a generic orthotic or even a custom one prescribed before anyone has imaged the foot is being built around assumptions. We do not know the actual angle of the joint deviation. We do not know how subtle the surrounding soft tissue is. We are modifying how the foot sits in a shoe without knowing what the foot looks like underneath. An orthotic built around assumptions about your foot is just one more expensive guess. Every conservative treatment performs differently depending on one specific piece of information about the deformity. Without it, you are treating a foot you do not actually understand yet. The people who get the most out of conservative care are the ones who started with clarity about what is actually going on and what they're actually dealing with. That clarity comes from one specific first step, and it is what separates the people who manage this well from the ones who spin their wheels for years. Point 3, how bad is your bunion actually? Before you make any treatment decisions, you need to know where your bunion sits on the spectrum because mild, moderate, and severe are not just words. They determine what is available to you. Here are the questions I would be asking myself right now. Has the bump gotten noticeably bigger in the last year or two, or has it just been roughly the same for the longest period of time? Can you still move the big toe joint up and down with your fingers, or does it feel stiff and locked? Is the pain coming from the bump on the side, or do you feel it deep inside the joint when you walk? Has the big toe started to drift towards the second toe, and is that drift getting worse? What these answers tell us matters. A bunion that is stable, mobile, and only painful on the surface is a very different situation than one that is progressing fast, stiffening, and producing joint pain with every step. The first one has real conservative options. The second one is already moving towards a conversation about surgery, and the longer you wait, the more complex the surgery gets. The person who needs to hear this most is the one who has had the bunion for years, knows it's getting worse, and keeps putting the decision off. Every year, the deformity progresses. With a year, the joint changes, and joint changes narrow your options. The single most important decision in this whole sequence is coming next. This is the move I would make before I agree to any treatment at all. But first, if this is making you think differently about your bunion and you want more of this kind of content, please subscribe. Every week I put up a video covering exactly the things most people never get told in a 10-minute appointment. Hit subscribe and you will not miss any of it. Point 4, the one thing I would not skip. If I had a bunion, the first thing I would do is to get a weight-bearing x-ray of that foot. Before orthotics, before an injection, definitely before surgery. That image is the only thing that tells you what you actually are dealing with. Weight-bearing specifically because a bunion behaves differently when the foot is loaded. The bone angle you will see when you're standing is not the same angle that you'll see when lying down on a table. The difference changes the treatment plan. The practitioner making a recommendation without imaging is guessing, and your foot deserves better than a guess. I have had patients come in after years of failed conservative care. New orthotics, different shoes, stretching protocols, none of it worked. We take a weight-bearing x-ray and find out the joint deviation is severe. The joint space is already narrowing and the conservative window closed 2 years ago. Every practitioner before me was treating the foot they had never actually seen. That image would have changed every decision that followed from the first visit. Stop agreeing to any treatment plan, conservative or surgical, before you have been seen and a weight-bearing x-ray of your foot has been done. If the practitioner you are seeing has not taken one, ask for it before anything else happens. What to start? Find a foot and ankle specialist, not a general practitioner, who does weight-bearing x-rays in the office. That is the appointment that gives you the information every other decision depends on. Here's exactly what I would do tonight, so the sequence has already started before you go to bed. Point 5, what I would do tonight. Here is what the image actually tells you and what happens next depending on what it shows. If the deviation is mild and the joint is still mobile, you are in the best position. That's where conservative care does really work. Proper orthotics built around the actual deformity of the foot and the anatomy of the foot with targeted footwear changes and strengthening of the muscles to support the big toe joint can help. In some cases, I will add a regenerative injection such as PRP or an amniotic injection to support the soft tissue around the joint and slow the progression. That combination done right can keep a mild bunion stable for years. If the deviation is moderate and the joint is starting to stiffen, the conservative window is still open but narrowing. This is where I get more aggressive with the regenerative treatments. The goal is to protect the joint and maintain mobility while we manage the deformity. Surgery is a conversation at this stage, but is not the only one. If the deviation is severe or the joint has already started to lose significant mobility, surgery is the right answer. And at that point, the conversation shifts to which surgery and how it's done. That is a different video. But the short version is that modern bunion correction done without metal hardware means faster recovery, no permanent hardware in the foot, and the outcomes that would have been impossible 10 years ago. Tonight, do these 3 things. Book an appointment with a foot and ankle specialist who does weight-bearing x-rays in the office. That is the appointment that starts everything. Write down how long you've had a bunion, whether it has changed over the last year, and which activities make it worse. Bring 2 questions. What does my joint space look like? And what are my conservative options given what you see? If this were me, I would make this appointment tonight. The image tells you where you stand, everything else follows from there. A bunion is not a stop sign. It is a starting point for making a good decision. Most people either ignore it until it becomes unbearable, or they go straight to surgery without understanding what else is available. I would get the image, understand what I'm dealing with, and then work the options in the right order. That is what gives the best chance of the best outcome, whether it's years of successful conservative care or a surgical correction done right the first time with no hardware left behind. If you want to go deeper on what bunion surgery actually looks like when it's done in the modern technique, watch the video on the screen right now. It covers everything most patients never get told before they consent to a procedure.